or therapeutic clowns or clown doctors. So basically, there was an American physician, Dr. Hunter Patch Adams, in 1970s, who introduced on the base or concept of Charlie Chaplin, who introduced the concept of medical clowns. Now, are we really surprised to listen these two different terms together? Medical, which is very serious term, and clowns, which is completely a circus kind of thing. So, very well said by Edmond Ravel. He is a popular clown in Israel. That these two terms are different, juxtaposing the medical, the serious thing, to the carnival spirit emotions of clowns. So how these work? How medical clowns work in pediatric industry or medical services? Basically, talking about the history part, we know in world smiles came from Charlie Chaplin, right? He got millions, like he got smiles to millions. Based on his concept, Dr. Patch Adams introduced medical clowns. He was an American physician. He was a doctor who dressed up like a clown in a pediatric oncology department and seen that after humor and laughter therapy, medical clowns do instill a positive attitude in children, and children then came to hospitals for their chemotherapies and radiotherapies long back in 1970s. So this becomes a success for him, and this also increases the life survival rate of children undergoing cancer therapies, because laughter and humor also increases the immunity. That's why he introduced it, and then later on, based on his concept, Michael Christensen also introduced Big Apple circles. That is, they train clowns and become clown doctors. Right? So they are not just only normal people, they are physicians or they are trained people who can work in OTs, who can work in pediatric oncology departments and even psychiatric departments. Then in India, our first clown was Rohini Rao, that was in Chennai, India, and we have an academy in India based on clowns, that is Clown Academy in South India. Talking about the evidences in medical field, because in dentistry it doesn't happen long back, but yes, too in medical field it happened, and not only in oncology departments but also in psychiatric departments, in diagnosis of sexually abused children, rather in diagnosis of cancer patients, because little pediatric patients are afraid of coming to the hospitals. That's why clowning helps them to just get with the environment of seriousness of the hospitals and get with their chemotherapies done. So there is abundance of evidence in the past, and these are all in medical services. Now, how it works? I just talked about the psychological part, that it induces laughter and humor. Definitely yes. So basically, there is 6 elements of clowning which works with. That is humor, repo, fantasy, active listening, pleasure, and diagnosis. It is not diagnosis, it is diagnosis. Because Dr. Patch Adams believed that because of his appearance, because of his big red nose and everything, the children got attracted and came to the hospitals for their diagnosis part. So it was not diagnosis, it was diagnosis. Now, this was all psychological part. But how clown helps in medical field? Why it was so popular since 1970s? So yes, definitely, it do have some of the biological effects as well. Like, for example, humor and laughter induce a lot of, it just release endorphins, which are stress hormones, and it decreases stress in the body. Secondly, it increases immunity by increases the levels of immunoglobulins, that is IgA, IgG, and IgM. And also, humor directly influences the levels of natural killer cells in the body, which kills the cancerous cells in medical field long back. So apart from the psychological effects as well, clowning do have medical effect and biological effect on the body. These are some pictures from across the globe where medical clowning was performed in cancer wards. So we can appreciate that the patients are very well happy with the clowns and they interact well, and because of that they go for their chemotherapy clowning has been performed specifically in Israel to have a positive effect. Now coming to clowning in Vietnam. Are you all aware of clowning really had happened in Vietnam too in Hanoi? In 2013, a great clown from Israel, in coordination with the embassy of Israel from Vietnam, there was a ill 3-year-old child in National Hospital of Pediatrics in Hanoi, and because the patient was very small and she was not taking chemotherapies, she was suffering ill. That's why a clown from Israel came specifically for her and gave clowning sessions. That was for 2 weeks, and it was seen that because of clowning sessions which he gave, the child was accepting the chemotherapies, and the life survival rate of the child increases to 20 years. So this happened in 2013 in Hanoi, but definitely because lack of attention towards that, clowning doesn't go continuous in Hanoi later. So he was a clowner that was from Israel, that was David Barashi. He performed and he also trained some doctors in National Hospital of Pediatrics. Now we have abundance of evidence in medical field, in medical services, also in psychiatric wards and everything. So why not in pediatric dentistry? Because pediatric dentistry is also dealing with children, and they are also very afraid of local anesthesia, the sounds of erotters and machines. So why we are not dealing this in pediatric dentistry? So based on this evidences, we in India tried to have a research based on all the medical evidences, and the research was the assessment of medical clowning in influencing the anxiety and behavior scores of children undergoing various general treatment. So it was the first time when we explored medical clowns in pediatric dentistry. So basically, we just compared two different modalities, distraction modalities, that was audiovisual aids with medical clowns. There were patients who were treated with local anesthesia under audiovisual aids, and some patients who were treated under medical clowns. These are some pictures where we were just giving local anesthesia, and just prior to the appointment and during the appointment, clowning session was performed for a child. And some pictures where we can see that a patient is really happy with the clown interaction. So after the study, we see that the results were tremendously good, where the pain scale and even the stress levels of doctors during clowning sessions was decreased when compared to audiovisual aids. Similarly, the Frankel scale, basically the behavior of a child when a child came first to the dental clinic and at supposedly fourth visit. So the behavior of a child becomes more and more positive because of clowning sessions. They just didn't love to come to the hospital because they were just willing to interact with the clowns. And because this was the first study in pediatric dentistry on medical clowns, so this was the team in Delhi. This is the team in New Delhi, India. Sheetal Agarwal and her team. Sheetal Agarwal is a PhD doctor from Delhi University, and she is basically from last 2015, from last 6 to 7 years, she is practicing clowning in various government and private hospitals. These are some of her work which was published on national newspapers and magazines. You can see. So a very big statement what she gave was that making patients not change their reality. We are not changing the reality. We are not changing the treatment of a patient. We have to give local anesthesia. A child has to go for invasive dental treatment. That is not true. We are not changing any reality. But yes, their viewpoints they are changing. Their viewpoints about visiting a clinic. Their viewpoints about having a dental treatment. So yes, that clowns do every time and every year. So this was the first study in pediatric dentistry regarding medical clowns. So we got a copyright from Government of India, and we can anywhere now practice clowning is valid 50 years past my death as well. Also a vegetable award from National University. Now, one more thing is to think is that sometimes even a distraction therapy that is effective with a patient. The pediatric patients are really unpredictable. So we go for non-pharmacological therapies like nitrous oxide sedation. That is very common nowadays. But the major folly with nitrous oxide sedation is a pediatric patient should accept the nasal hood to work with. If the patient is not accepting the nasal hood, so the nitrous oxide sedation cannot work properly. So to accept the nasal hood, the patient should be calm, the patient should have the least pre-operative anxiety, and then the nitrous oxide sedation will work. So with that thought, we just combine pharmacological with non-pharmacological. And there was another research done on basis of medical clowns that we just reduced the pre-operative anxiety in pediatric patients with medical clowns and then went for invasive dental treatment under nitrous oxide sedation. Okay, so these are the pictures where a medical clown and parent accompanying a child to a nitrous oxide sedation room so that a patient, an anxious patient, can accept the nasal hood and can accept the nitrous oxide machinery. So again, this was a study which was divided into 3 groups where we compared that if a patient is accompanied by a parent alone, or if a patient is accompanied by a parent or a medical clown, or if a patient is accompanied by a medical clown alone. So we have just evaluated that in which group there was a least preoperative anxiety, and because of least preoperative anxiety, the concentration of nitrous oxide at which a patient got sedated was also reduced. For example, if a child has a least preoperative anxiety, so at almost 30% of nitrous oxide sedation, the patient got sedated and had invasive dental treatment done. So these are the pictures where a patient is being adapted to a nasal hood of nitrous oxide machine, and whereas a planner is helping the patient to adapt to the dental clinic, to adapt to the dental chair, and to adapt to nitrous oxide sedation as well. So in this study also, we got results where group 2, that was when the patient was accompanied by a parent as well as medical clown. These groups basically had the least anxiety, and with these least anxiety, the concentration of nitrous oxide given to a child, to a pediatric patient, was also reduced. So actually this study in dentistry was in relation to completely same study that happened in medical field that was done by Vignoli, where he compared that during prior to the anesthesia, that is induction of anesthesia, prior to the induction of anesthesia, when a pediatric patient was accompanied by either parent alone or the parent and a clown or with a clown alone. So this was a similar study which happened in the medical field prior to the induction of anesthesia in OTs, that is in medical services. So the result was same, that when the child was accompanied with parent and medical clown, both the anxiety was extremely reduced, post-operative anxiety was also reduced, and also post-operative hospital time period was also reduced because patient was really adapting to the hospital, really adapting to the medicines which was given, so the patient was recovering at a higher speed. Right? So because this was a study with nitrous oxide sedation as well as medical clowns, again this had got a grant of INR 10,000 from Indian Society of Pediatric Dentistry, that is the National Society of India. Now we have just in the last 15 minutes we have a lot talked about all the positivities of clowning, that it is well happening with medical services and pediatric dentistry as well. But what are the major limitations? What I felt in 2 of the researchers, what are the major limitations of medical clowns? First is coulrophobia, which is clown fear. Definitely yes. A child who is very young. In both of my studies, the age group was more than 4 years. The age group was basically 4 years till 10 years. So the child who is very young, who is very age of 2 or 3 years, he might fear from a clown, fear because of their appearance. So that is coulrophobia. For those patients, it doesn't work. Although there was a study where it was seen that the fear of clowns was relatively least in the age of 3.5 years, and across the world it is just 1.2%. The fear is just 1.2% in children, otherwise children love clowns. But yes, that should not be negligible as it. Second limitation is its cognitive development. So to any behavior therapy to happen and to just adapt the child to the communication, every child needs to communicate first with the dentist or with a medical clown. If a child lacks cognitive development, for example, a child of 2 years who lacks cognitive development cannot interact with the doctor, cannot interact with medical clowns. At that stage, medical clowning doesn't work, where a child is lacking cognitive development. So these are the major two limitations which happen with medical clowning in both the research. So yes, it's a completely different, completely contemporary approach of distraction, and I was surprised when I see that it also happened in Hanoi, in Vietnam, in 2013, which I showed in the slide, that it happened in National Hospital of Pediatrics, where medical clowning worked tremendously good with patients with chemotherapy, and the patient survived 20 years later as well. Like, the survival rate was predicted that patient will survive 20 years more because of clowning. So it happened in Hanoi, but it is not continuous in Hanoi, and it's a completely new approach. So yes, why not to continue with? Because yes, humor ease the power of healing, distract traumatic patients, reduce their anxiety, and alleviate the pain, conferring the patient with a sense of laughter, creativity, and care. Right? As we can see this picture, that pediatric dentistry is all about happy smiles and colorful hands, and it is very well said by Charlie Chaplin that to truly laugh in life, we have to accept our pain and we have to laugh through the pain. So it similarly happens in our dentistry, that a child has to accept the situations and to having a perfect dental treatment. But to accept that situations, we have to give him a very comforting environment. And that's what clowning do. It gives a comforting environment, it reduces laughter, it reduces humor, and also some of the biological effects. So yes, definitely, it is worth to explore clowning in pediatric dentistry now. Thank you.